Hello, I'm Dr. Samantha Durland. I'm board certified in obstetrics and gynecology, as well as anti aging and regenerative medicine. I'm also fellowship trained in metabolic and nutritional medicine. And today we are going to talk about the difference between functional medicine and westernized medicine because sometimes it's very confusing. So, what does this mean? And also, what is the definition of wellness? Well, I believe with the definition of wellness and wellness clinics, that's such a myriad of different types of facilities. That can include anyone from a chiropractor to a naturopath or anyone that's trying to help people be well and not sick. When you think about classic westernized medicine, we are super good at helping with acute illness. If you break your arm, if you have a heart attack, if you have metabolic dysfunction or something acute that requires treatment. Now, chronic illness is something different. Chronic illness lasts for a long while and oftentimes requires behavior modification and lifestyle modification. And that's really hard because and it requires a lot of energy and it requires a lot of persistence. And so, what I like to do oftentimes is we are very passionate about helping people find their best sense of self, which does require us to kind of dig in to lifestyle, how we eat, how we move, our belief systems, so that our health can be optimized so we stay outside of an acute system. So when you think about being a physician, we go to medical school, we go to residency, and we specialize in a various subject, if you will. Some of us focus more on the heart, and some of us focus more on the brain, and others of us focus more on the endocrine system. And family practice and internal medicine physicians are focused more on the body as a whole, but they're also more of a gatekeeper between referring you to these different points of specialty. So what we like to do is here in a functional integrative medicine role is for looking at your body as a whole and how each part of your body relates to the other part of your body, so that we try to look at this global picture of an individual, not just on laboratory forms, but listen to you, kind of see your history, your belief system, how your body functions, and try to put it all together. Because we're not just our heart, we're not just our brain, and we're not just our reproductive or endocrine system. We're all of it put together, and we're all a little differently. So I believe in a functional integrative medical role, we're really trying to put all of these concepts together and make a treatment plan for patients so they can find their best sense of self, integrating both our thought process, our metabolic function, your traditional medical history as well. So I think that's what sets us apart, is that here in our office, we are very conventionally trained, but we've kind of jumped outside the box to embrace all of these aspects of care, whether it's an acupuncturist or a naturopath. And while we are not a naturopath and we're not an acupuncturist, we're just helping you kind of navigate all of those spaces, because certainly there's not one space that fits all, and we're all different. And I think we all are trying to understand how to integrate all of these together and help our body be our best sense of self. So here we are conventionally trained individuals, nurses, PhD, nurse, our medical assistants, but we're just also helping people navigate their body as a whole, their psychological health, their physical health, and we kind of bridge this world between conventional training and chiropractors and naturopaths and your trainer. I mean, when you really think about it, all these folks are trying to help you be your best sense of self, and we're just trying to help put that all together and help people understand how to interpret the results and give them objective data to follow up on their successes. So I hope that explains a little bit about what we're doing in a different way. And what sets us apart from other wellness clinics is, again, we're very classically trained in westernized medicine, and we understand how to navigate that market and that space, but we also understand how to navigate these other spaces, and we just help you figure it out. So I hope you have a great day, and thanks for tuning in.